Hi guys, how are you? My name is Dr. Alexandra Kopelovich. I'm a physical therapist here at Back to Health Physical Therapy. This is Tuesday Night Tips with Back to Health. Today's topic for discussion is going to be shoulder pain and how that relates to scapular dyskinesis. Alright, so first off, we need to start by defining what scapular dyskinesis is. And that is basically poor movement of your shoulder blade. So why do we care for it? So you go to your doctor's office because you have shoulder pain. Your doctor looks at your shoulder and he tells you you have arthritis. He tells you you have a strain, a sprain, a tear. He tells you you have instability in your shoulder. He tells you you have an impingement or a frozen shoulder. So all of that is great. What are we going to do for that? So your doctor basically gives you a pathoanatomical diagnosis, which means that what can you do for it is just take medication. But what do physical therapists do? We look at the actual source of the problem, at the mechanical problem. So we look at the pathomechanical diagnosis of all of that. So as a physical therapist, I'm gonna look at your joint motion and see how that relates to the pathoanatomical diagnosis that your medical doctor gave you. So scapular dyskinesis can actually be adjunct to all those issues that I mentioned earlier, to all the pathoanatomical issues. So let's take a look at the anatomy first and see what I mean by that. So Max is going to be, Max, thank you for volunteering. He's going to take off his shirt, so we're going to go through a little bit of anatomy and what we're talking about. So scapula is your shoulder blade, like we see here. So a lot of people think of shoulder as just being this region right here. So in general, our shoulder has 4 joints that we're going to cover today. So it has, we're going to start from the front. It has the scapular SC joint, scapulo-clavicular joint, clavicular-scapular joint, right here at this point. And this is the only connection, and this is the only connection that we have of the shoulder to the rest of the axial skeleton right here. Then we have a acromioclavicular joint, which is right here. Then we have glenohumeral joint, which is right here, and we have the scapulothoracic joint, which is right here. So all of these joints, they have to work together. There is a mechanical balance that has to happen and different certain motions that have to happen in the joints in order for you to actually lift your arm up. So it's not as easy as we think. So basically, we're gonna look at the shoulder. So you come in for physical therapy evaluation. As a physical therapist, I'm gonna look at all of these joints, So, and today we're only gonna look at the shoulder joint right here, the scapular joint at the shoulder blade. Okay, so a little bit about the shoulder blade joint. So it's the only joint right here that is actually not connected by the ligaments. And the only connection that it has to the body is actually by muscular connection. So what does it mean to us? So if it's only connected to your thorax by muscles, and then, I don't really have a picture of that, but it's basically your shoulder blade is floating in the air, and the only connection it has to your ribs is by muscles. So we have a bunch of muscles that are responsible for stabilizing that shoulder. So we're gonna go over some of these muscles that are important for us to know. So basically, I'm gonna name a few muscles that work together in order to lift your arm up. So some of these muscles is gonna be the upper trapezius, Maxime. The upper trapezius that starts at your neck and goes all the way to your shoulder. We have the middle trapezius right here, and we have the lower trapezius fibers which span from your shoulder to your spine. And last but not least, we're going to mention serratus anterior. It's the muscle that starts on the bottom of your shoulder blade and it spans onto the thorax, and it stabilizes your scapula, your shoulder blade to your thorax. So this is actually one of the most important muscles that we're going to mention today, and we'll show you how to work it and how to stabilize that muscle. So like I said, Max, he comes in to the clinic, he says, I have shoulder pain. So the first thing I'm gonna do, I'm gonna analyze, just observe, see how his shoulders are sitting on his thorax. And I can already see some winging right here in the bottom on both sides of the shoulder blade. So that tells me to look closer into the muscles that are responsible for keeping the shoulder on the thorax. So going from here, I'm obviously gonna assess different parameters of that, but that's not what we're interested in today. So we're gonna assess the motion. That's what we're interested in today. So Max is gonna lift both arms upwards. He's gonna go up all the way. Okay, and he's slowly gonna come down. And what I'm looking for is how his shoulder blades are working. So what we notice here, as Max comes up, he's gonna come all the way up, and you're gonna see the activation of this muscle, how the bulk on this side of this muscle is so much more than this side, than this muscle. That tells me this upper trapezius muscle is not working the way it's supposed to be working. So he's gonna slowly lower it down. And now, to the juice of it all, of today's conversation, of today's topic, is actually the winging. So you can notice Max is gonna go up, and on the way down, you're gonna see the edge of the scapula, which is gonna be very very much defined. So he's gonna come down, stop here, and you can see how the shoulder blade actually comes off the thorax, and that's not supposed to happen. The shoulder blade is supposed to be stuck onto the thorax. So for me to see if the stabilization is actually an issue, what I'm gonna do, I'm gonna manually stabilize him and see if that can fix the problem. And you're gonna start from here, and you're gonna slowly lower your arm down. Lower it down, lower it down, lower it down, lower it down. And that definitely helps the scapula stay on the thorax a little bit better. And also, as a patient, I'm gonna obviously address the issue. I'm gonna say that decreases your pain, and he's gonna say, in this case, he's gonna say yes, because that's the direction we're going into. So manual stabilization helped address his issues right here with him. So we're gonna target the few muscles with Max. So as we can see, the medial border, or the side closest to the spine, is more prominent than the other side. Also, his inferior angle, or the bottom of the shoulder blade, is also winging. So we have two possible muscular involvements. We have the serratus anterior that I mentioned earlier, that's probably involved, which is the muscle number 7 right here. You can't really see it from the back here, but this is the muscle that stabilizes your shoulder blade. And then possibly the lower trapezius muscle, which is not adhering the inferior angle to the thorax. Okay, so Max comes in with this problem. What are we gonna do? So manual stabilization helped. Now I'm gonna see if he can actually do that in the exercise form or shape. So Max is gonna go on, actually, can you go on the floor for me? So what we did, we tested Max in the open chain, which means that Max's hands were free up in the air. So right now I want to see how he functions in closed chain position. So we get Max on the floor, and he can be on his knees, that's absolutely fine. And what I want him to do is a push-up plus. So he can go into a push-up position, he can do a push-up, and then come up for me, and then go all the way up. Beautiful. And then do another push-up again. So in Max's case, we can see how both, so do it without a plus for now, just as an example. So stay here, perfect. So we can see how he's staying in his neutral position, and his shoulder blades are already winging. His lower trapezius are really working hard to stabilize him there. His upper trapezius are working really hard to stabilize him there, which means one of the muscles is not working correctly, and that's your serratus anterior. So in order to activate that muscle, I'm gonna ask Max as an exercise to do, you can go into a push-up, and now you're gonna come up, all the way up, and you're gonna do a plus. That's it. So what you're doing right now is exactly what serratus anterior is responsible for, is protracting your shoulder forward. And we're gonna train just that motion, going from up to down, from up to down, in order to stabilize the scapula a little bit better on the thorax. So this is how I would start Max's program into stability of the shoulder. So we can go from there, sorry Max, can you get down again? So I'm gonna show you a little bit of progression, how we can progress that. So say Max is not winging any longer, he's obviously still winging, but that's fine. So I'm gonna have him go into a plus position, that's it. And now I'm gonna ask him to reach his arm towards my arm.
Left?
Doesn't matter. Okay, so say the left shoulder is bent. He's gonna reach the right arm towards me, and then he's gonna try to stabilize himself there. So get yourself into a plus, that's it. And now reach your arm out, and then keep it here. Keep it here, okay, and down. And now try again, reach it out towards me, and bring it back, that's it. And now reach it out towards me, and bring it back, okay? So that's the second level of complexity. We can add more to it. We can actually take a foam pad, for instance, or a Bosu ball here, and we can create uneven surfaces for Max to be on. So you can put one of the arms. So we're gonna use the stabilizing shoulder, which is gonna be, we're trying to fix the left shoulder right here. So the left shoulder is gonna go in the middle of the Bosu.
Okay.
Yeah, that's it. And you're gonna go into, you can do modified plank. Okay, so see, he's already so winging right here. So this is obviously not where I'm gonna take Max, but he's gonna go into press up. Beautiful. He's gonna hold it here, and now lift his arm. Give me a high five. That's it. Beautiful. And back down. So, and now we need to adjust his position. Make sure he's standing in neutral. Come up a little bit more. Through your thorax, through your shoulder. Yeah. Beautiful. And now give me a high five. And again. Okay. And that's how we're gonna try to stabilize it. We can also add manual perturbations if you want to make it a little bit more, progress the challenge a little bit more. So Max, can you please get on the Bosu for me?
Most definitely.
Thank you. So
Can I use my right arm?
sure, you can use your arm. So Max's right arm hurts
My
now.
arm.
Yeah, so that's what we're gonna stabilize. He's gonna press up into it. That's it. And now manually, I can give him that challenge to address. And Max is actually so much stronger on his right side than his left side. So once again, just to Max, you're good. Thank you so much. So what we covered today was scapular dyskinesis, which is poor movement of the shoulder blade on the thorax. We care for that because it's a mechanical issue that can be addressed by physical therapists. And you can do certain exercises to stabilize and to prevent that. So today, the prone press-up that we showed you was one of the exercises that you can do as a homework for yourself as a preventative care for that issue. If you have any questions, comment in the box below. Bye!